everyone. Bonjour et bienvenue à notre séminaire PAP pour le mois de février. Already into February and our PAP seminars are going on. We are very pleased today to have 4 guests, our own David Brown, and I will allow him to present his co-authors and colleagues from around the world. David Brown is a longtime member of our PAP program, professor, as well before former civil servant, senior civil servant, who we all know and love very well. So today we're going to actually have presentations from our 4 members, and after that we will have our informal discussion and conversation. So without further ado, David Brown, the floor is yours.
Thank you. Now, yes, here we go.
We can see it.
Okay, thank you. Alors, bonjour tout le monde. Hello, everybody, and welcome to the PAP seminar. What we're doing this morning is presenting a book that is, in fact, due to be published as we speak. Steve Troupin, I think, will be able to give us an up-to-the-minute account in just a minute. If not today, certainly in the next day or 2. The title, Dealing with Disaster, Public Sector Capacities for Crisis and Contingency Management. I think that speaks for itself. You see the graphic we've developed, the mood that it creates. So what I'd like to do to start with is just present the 4 speakers. This is all being done in the context of the work of the International Institute of Administrative Sciences, known as the IIAS. For those who aren't familiar with that particular institution, it's the international counterpart of the Institute of Public Administration of Canada. And it's an organization that brings scholars and practitioners together in the field of comparative public administration. So that's the subtext of the book. The IIAS launched a project on safety and security some years ago. This book is the product of that. Talk briefly about the project itself, and then present the publication, including potential areas for future work. Now, I'll say up front, this book predates the COVID-19 pandemic, but there's no question, to start with, public health disasters are very much within the scope of the field that we're talking about. And of course, the COVID-19 pandemic is a case in point of what can happen. And in fact, it has a particular interest because of its global nature, which brings into play the kinds of comparative, institutional, and environmental dimensions that we look at in the book. So in the presentations that we're going to be making, we won't talk about COVID-19. We're hoping, though, that there will be some time at the end of the period that we have. And we'd then like to come back and look at the COVID-19 pandemic, the experience with it, through a comparative public administration lens. The panel, well, starts with myself, and I guess said what I'll be presenting. What we have in the book itself, there are 4 Canadian authors. You'll see there are 29 authors who contributed to the book altogether, 4 of whom are from Canada, and this panel is 3 of the 4. The 4th one I'll just mention is Ida Memuji, who is a former PhD student at the University of Ottawa in PAP, now teaching at York. She, though I guess, is responding to higher demands. She became a mother about 6 weeks ago, and she sends her regards, her congratulations, but also her regrets. So the other 2 authors are Anaïs Valiquette, who teaches at California State University, but before that received her PhD at the École nationale d'administration publique du Québec, Canadian, teaching in the US, and has that perspective. And she'll be writing or speaking about a chapter that she did based on her doctoral work, looking at the Lac Mégantic rail disaster as a case study in the role that regulation and regulatory failure can play in disasters. Our second speaker, or the third speaker, is Lorraine Touchant, who is a postdoctoral fellow in the Center on Governance, which is co-sponsoring this event at the University of Ottawa. And she'll be talking about a chapter that she wrote on the role of the international system in disaster response. And I should say right here that Lorraine played an invaluable role as an unpaid research assistant for this book. I don't think we would have got to this stage without her help. So I want to thank her, recognize that role. And I should say her predecessor in that same role was Ida. So there's been that contribution from the graduate students at U of O through the entire cycle of the book. And then finally, we have Steve Troupin, who is the executive secretary of the IIAS, which is based in Brussels, and he'll say a few words about the IIAS itself and its research and publication programs. Now, before I go on, I have to note the fact that Anaïs is in California, in Los Angeles, or at least in the greater LA area. Steve's in Brussels, so we've got a 9-hour time zone spread, which is, an indication of the global nature of public administration of this particular topic. We're walking the talk here. So let me just say a few words about the IIAS. It is, I think it can safely claim to be the leading practitioner stroke academic network in comparative public administration, international counterpart of IPAC. Founded in 1930, this past year, there were a couple of global events, virtual events, to mark the 90th anniversary. It's also a bilingual institution. It operates very much in both English and French. Canadians recognize it and I think feel comfortable in it and can contribute. And there's been a major Canadian contribution over the years. It has a range of programs very similar to anyone who's involved with IPAC that they would be familiar with. An annual conference this year coming up in Johannesburg, hopefully in person, at least virtually. It publishes a well-respected international journal, the International Review of Administrative Sciences, IIAS, and has a series of study groups in comparative public administration leading to publication. And this is one example of that. There are several allied or affiliated agencies. Perhaps from our point of view, the most important is the International Institute of Schools and Institutes of Administration, known as IASA, which is the counterpart of the Canadian Association of Programs in Public Administration, CAPA, yes. Now, Canada has been a member from 1980 to 2015. There are several categories, but the Canadian government, most recently the Canada School of Public Service, was what was called a member state, and through that facilitated the participation by IPAC as a national section, so-called, which in providing the umbrella for participation by individual Canadian academics and public servants. Unfortunately, that was a victim of budget cuts in 2015. Frankly, it was also a victim of a shift in our official development assistance policy away from support to governance and administrative capacity building. And I'm saying all of this because I think there's an opportunity here for the Canadian government and Canadian public administration to resume some very important work. Now, the IIAS Project Group on Safety and Security, it was formed in 2010, so as long ago as that. looking at national public capacities for crisis and contingency management and related international coordination in addressing disaster situations. Those were the two elements of the mandate of the working group. The chair of the working group or project group was Jacek Czaputowicz at the University of Warsaw, who most recently spent 3 years as the foreign minister of Poland, although he's now gone back to academic work. And I was what's called the rapporteur, which translated into the lead editor for the project. The group met several times. It was given a major impetus shortly after it was formed by the so-called triple disaster in Japan, the earthquake that triggered a tsunami that, among other things, provoked a meltdown of a major nuclear site. And even though it was a disaster the Japanese were fully prepared for, they're probably the best prepared country in the world in this field, the leading edge, they were overwhelmed. And that really helps to illustrate what we're talking about when we talk about disasters. And this has been the subject of discussion, both within the IIAS and also in a number of other countries. The publication really was mainly ready to go 4 years ago. There's a whole story here about how the vagaries of this kind of project, I think, was hit by not just Canada, but other countries pulling back for various reasons. And it lost its way. And ironically, it was the COVID-19 pandemic, I think, as much as anything, that helped to get us going again. I guess this is a way of saying that if and when you look at the book, you'll see that I think the framework is one that is robust and provides a basis for going ahead. Some of the case studies are a little bit out of date, but that's simply an invitation to continue the work. So the book itself, I've provided the link. It's coming out as an ebook in the first instance, and through the IIAS website. Hard copies will also be available on order. 21 chapters, 29 authors representing 12 countries, all 5 continents. I think we can claim to be a truly global project. 4 thematic areas, and I'll go through them in just a minute. Although all the authors were given a framework to work from, so regardless of the starting point, they all build on disaster cases. They all address the international dimensions, and I think one of the themes is that there is an international dimension in just about every major disaster. And it being the kind of project it is, it ends up with a list of areas for future research. So it sets a framework, provides some current material, and then offers an incentive to keep the work going. So to start with, there are a number of cross-cutting issues. You have the chapter themes there, theoretical considerations. That's actually a chapter that Lorraine and Ida, based on their doctoral research, produced. Risk management, a very big part of disaster management. Regulatory failure, that's Anaïs's chapter. Scenario building, techniques of trying to forecast where are the areas of vulnerability. Some interesting work there. And response management models, a fascinating chapter comparing wildland firefighting in France and the United States, and looking at the public administration models that lie behind the differences between them. Who knew? But it's a really very interesting piece of work. Second area, international and regional collaboration, looking at the UN system. That's the chapter that Lorraine will talk about. Intra-donor coordination. Ida Mamouji did her doctoral thesis on looking at how Department of National Defense, CEDA, the aid agency at the time, and Foreign Affairs worked together in developing the Canadian response to the major earthquake in Haiti in 2010? And the short answer is not easily. They weren't used to working together in an area like that. And it took, there were a lot of difficulties along the way. Space tools, the use of, especially somebody from the European Space Agency perspective, how those are brought to bear in disaster response, and issues of regional coordination which arise. Because one point about disasters is they don't respect geographic or political or social boundaries. And then a series of case studies. Then a series of institutional case studies. Every country has its unique institutional environment for responding to disasters. And one of the major challenges in comparative public administration is to try and find a common vocabulary framework for comparative discussion, recognizing that there are distinct requirements, but there are also lessons to be learned, opportunities to be had in looking at other jurisdictions. And then a series of case studies of individual crises, including 2 relating to the Japanese disaster. So let me just talk a little bit about the substance. The starting point is, what is a disaster? What do we mean with that terminology? And in fact, there is quite an academic literature on this, and that's part of the chapter that Lorraine and Ida wrote. But the proposition is that what the term disaster, I mean, it's not randomly selected, it has meaning. It's at one end of a spectrum from identifiable risks to extreme events. One of the chapters uses talks about a disaster as a time of complete failure, loss of meaning. I mean, it becomes almost philosophical, existential in its dimensions. Emergencies are contained. I mean, if you go further back in the on the spectrum, emergencies are contained, disasters are not, at least for a period of time. And as I said earlier, they cut across administrative and societal boundaries. Human decision-making before and during an event can determine whether an emergency will become a disaster. And that's your link to public administration. And in the spectrum, there's in the cycle that can be described, there's a key stage, what you might call a crisis. You have an emergency which comes to a crisis point, and the crisis, a time of great danger, a decisive moment, a moment of decision-making. And the decision-making can then determine whether things continue to fall apart, you move in the direction of disaster, or can it be contained and brought back to something that's more manageable within the normal constraints. A starting point is sources of risk, hazards, and that part of a very important part of all of this is a recognition that every hazard has its unique characteristics and requires tailored responses, and that you're also acting within unique societies and systems of government. Every society has a set of disasters. It has an institutional framework within which you can anticipate them, you can plan for them, and within which ultimately you respond to them. And I guess I should say, when we talk about decision-making, it's not only decision-making at the time of the event, but ahead of the event. And this is a point that Anaïs will be making especially, but also when we look at the COVID-19 situation. A lot of the problems that every country is facing, certainly in Canada, in fact, you can find the origins in decisions that were taken, good or bad, ahead of the beginning of last year. And of course, these were then compounded in some cases, or attenuated as it might be, by decisions that were taken at the time as events began to unfold. But the event unfolding is simply partway through the story. It's not the beginning of the story. So let's talk about crisis and contingency management from a public administration perspective. To start with, by its nature, it's cross-disciplinary. It touches on every aspect, not just of public administration, which in fact itself is a multidisciplinary discipline, but it reaches across the social and also the natural sciences. It goes to the fundamental role of the state and its relationship to society. The state does not usually cause disasters, but it is always, and I emphasize that, it is always called upon to address them. Typically also involving all levels of government. In fact, there's very clear that there's a whole line of inquiry coming out of the COVID-19 experience. But what difference do different national systems of governance, federalism versus unitary systems and so on, what difference may they have made in how countries respond to that kind of event? The state cannot deal, another proposition though, is the state cannot deal with a disaster on its own. This is an all of society kind of event. However, it can make a significant difference, including making situations worse. The third point here is that disasters are largely random as to who is affected. They do not respect jurisdictional, institutional, or social boundaries. They are, by definition, all of society, hopefully in a contained area, but looking at something like COVID-19, very genuinely, not just all of society, but all of global society. Disaster response, or at least the public administration response, is based on risk management, the certainty of uncertainty. So you're looking at situations that are outside your established institutions, your established routines, your ordinary planning cycles. And in fact, they can, and almost by definition do, overwhelm established institutional environments and processes. The state itself can be affected, but the greatest impact is on non-state actors. And indeed, this is one of the key points, that for a society to successfully respond, the quality, capacity of the state is extremely important, but at least as important is the capacity of society at the community level and the level of individuals and households. And typically, disasters cross internal and international jurisdictional boundaries. So when you're looking at crisis and contingency management as a domain of public administration, there are a number of challenges. So a key starting point is the diversity of potential crises. Every country has its particular combination of hazards growing out of geography, economy, demography, history. Some societies, have, if you go to Japan, I mean, it's a deeply felt part of the culture. They're on a major seismic zone. They have tsunamis are a regular risk. It goes back into prehistory and so on. Natural hazards grow out of combinations of geography and climate. And situations that in one place are relatively normal, in another are potentially create disasters. I mean, just look at the experience in the last week in Texas with the kind of weather that we've been getting here in Ottawa just in the last week or two, and the total contrast in how the societies have responded. Another example, Japan regularly has earthquakes in the order on the Richter scale of 7.0, 7.5 in that range. And they're ready for it. This is routine. It's like a major snowstorm for us, or almost. Haiti in 2010 had an earthquake at that level of that nature. It completely devastated the country. They're still recovering from that. So what was a disaster in Haiti is simply an emergency, if you like, in Japan.
David,
Human-induced hazard. often.
I'm sorry to interrupt. I just wanted to play my role as time referee, just to let you know that we've gone over the 20 minutes, just so we ensure that the other participants and discussion. But
all right, okay, I will wrap up. I think there's this slide and maybe one more. Human-induced hazards often interact with natural forces, and it's understanding those natural forces and what can be done about it from a human perspective that is particularly important. So the kinds of events you get: transportation, industrial accidents, critical infrastructure, epidemics, and human other health hazards. And then on the scale of these things, I mean, you have specific disasters, so something like the Lac Mégantic crisis, or disaster rather, was relatively contained. But you also have in the vocabulary, in the way of looking at these things, events that stretch even those boundaries, and the terminology wicked problems arise. So the earthquake in Haiti, that was definitely for Haiti a wicked problem. The pandemic, the global pandemic, clearly is one. Climate change, I think, is another that we're only beginning to understand. So let me just check how much more. So national capacity plays a role. International actors are important. Lorraine will talk about that. And that crises and disasters particularly stressful for developing countries. Okay, I've got here, we can come back to it later on if there's time, some of the areas that in the book we've identified as areas for future work. It grows partly out of the structure of the book itself. There's more theoretical thinking, more institutional reflection and analysis. Certainly, there are crises occurring all the time, emergencies that warrant learning. And I guess that's one of the basic themes in all of this. You can define a life cycle of disasters, not dissimilar to the policy cycle that academics like to refer to. But a key point, I guess two key points. One is anticipation, so you can take mitigating actions. And the other is learning, following the events. We don't want to just leave it all behind, but we do along the way. And in fact, even during the event itself, keep a corner of the mind trying to understand what is going on, what are the lessons, how do we adjust, how do we anticipate for the future. Okay, why don't I stop there? And as I say, if we have time, we can come back to some of these points, but hopefully this kind of helps to set up what it's all about, and maybe to open a conversation. So I will stop my share and turn it over to Anaïs.
Hi everyone, bonjour, bon matin, bonsoir, dépendamment où vous êtes sur la planète. C'est un plaisir d'être avec vous. Merci beaucoup de cette invitation à présenter mon sujet de thèse doctorale. Je vais faire mes diapositives sont en anglais. Je vais faire ma présentation dans les deux langues. Je vais essayer de résumer ce que je dis en français rapidement avant de passer à la prochaine diapositive. Merci beaucoup, David, pour cette introduction. Mon chapitre dans l'ouvrage porte essentiellement sur les observations que j'ai faites au courant des 3 années mes 3 années de parcours de thèse doctorale. Donc, lorsque la tragédie est arrivée en 2013, j'avais déjà un sujet de thèse et j'ai décidé de réorienter ma thèse pour vraiment apprendre quelles sont les leçons de cette tragédie, du plus grand déversement pétrolier en Amérique du Nord, et aussi du du déraillement ferroviaire le plus meurtrier qu'a connu le Canada. Donc, c'est un échec au niveau de la réglementation. Je crois que David en a touché sur ce point. C'est vraiment donc ma présentation va porter sur quel est le rôle des agences qu'on appelle oversight agency. Ça se traduit un peu mal. It's hard to translate the term oversight agency, mais les agences gouvernementales qui sont en charge finalement de la préservation de la sécurité publique et la préservation environnementale. Donc, qu'est-il arrivé? What happened? And then what did they blame? A little bit, I'll touch upon who did they blame, because I use the grounded theory approach, and without throwing too much theory at you, the grounded theory approach is really it follows an inductive process. You're not going to select a hypothesis at the outset of the research. You're going to observe and then come up with a theory. And I've applied Freudenberg's framework because it was the most fitting, although there were some anomalies, including the Lac-Mégantic case was an anomaly in the sense that the theory didn't really coin what happened. We needed to look for a new theory to understand the processes at play. Donc, c'est sur quoi ma présentation va porter. Les observations et puis cette théorie que j'ai proposée à l'issue de mon analyse, que j'ai appelée la théorie de la régression, pour essayer de comprendre quels ont été les facteurs qui ont empêché l'apprentissage post-crise d'avoir lieu dans certaines sphères décisionnelles. Donc, en résumé, les événements, donc il y avait un train qui partait, donc il y a eu un boom pétrolier au niveau de la région du Bakken, et puis énormément de cargaisons de pétrole ont été absorbées par le réseau ferroviaire. Et le chargement en question est parti de la région du Bakken pour se rendre à la raffinerie de Saint John au Nouveau-Brunswick. Et en passant par de grands centres de population, donc Montréal, Windsor, Toronto, et passait souvent entre les États-Unis, le parcours a souvent traversé la frontière. Donc, c'était un train qui était en destination de Saint John au Nouveau-Brunswick et qui a traversé la frontière à plusieurs reprises. Et la compagnie, un des sous-traitants ou une compagnie qui aurait été engagée par Irving Oil pour transporter son pétrole était Montreal, Maine and Atlantic, qui avait une longue histoire au niveau de son taux de violation, si on veut, là, de la réglementation en place. Donc, il y a eu beaucoup d'événements préalables à la tragédie qui pointaient du doigt la capacité de gestion des risques de la part de cette compagnie. So that company had a long history of safety mishaps, and it was also experimenting or piloting a single operator cruise, and which was something the federal regulators could not overturn. They'd given up the capacity to overturn such regulations, such decision making, such a prohibition. And it was left this unattended overnight, which was the regular practice near the small town of Lac-Mégantic on the main track without any derail, and as it was regular practice at that point. Now, la cargaison était de 2 millions, environ 2 millions de gallons de pétrole brut, et avait été donc laissé au courant d'une nuit sans personne pour le surveiller. Et il avait connu, l'opérateur du train avait réalisé que son train avait des problèmes techniques et malgré tout, avait laissé la locomotive principale en marche. Et donc, un train d'environ 2 km, 1,5 km avec cette cargaison de produits dangereux laissés avec cette locomotive défaillante sur une pente. Et puis, la pente était juste un peu en dessous de 1%, mais est-ce qu'il y a quand même... et donc, pour faire bref, un citoyen a remarqué que la locomotive avait pris feu. There was a fire on the locomotive that had those mechanical problems, and the firefighters used the manual given to them by MMA in order to shut the train off. And then they handed over the train to a representative from that company. So, après que l'incendie a été contrôlé, on a fermé la locomotive et puis on a remis le train à l'opérateur. Ce qui est arrivé par la suite, aux petites heures du matin, c'est que le fait que la locomotive a été éteinte, tranquillement, il y a eu une perte de pression dans les freins à pression. Puis, il y avait des dispositifs de sécurité qui ont échoué parce que la perte de pression était trop basse pour pouvoir être détectée par les mécanismes de sécurité. Et donc, le train s'est remis à rouler sans conducteur et a déraillé dans la courbe au cœur du lac mégantic. Il y avait plusieurs jeunes dans un bar qui célébrait un anniversaire. Le musicafé a été... en fait, la plupart des victimes étaient les jeunes qui se retrouvaient dans ce bar à ce moment-là. Et donc, ils ont été tués soit par le feu ou par la destruction des bâtiments dans lesquels ils étaient. Et donc, c'était une catastrophe environnementale. La plupart du pétrole a brûlé sur le coup, mais la perte en termes de vie humaine était vraiment dévastatrice. Ça a créé toute une onde de choc. Et c'est dans cette foulée que j'ai décidé d'entreprendre la thèse sur cette tragédie. Donc, au niveau de la contamination environnementale, c'était vraiment sans précédent également. Okay. Donc, avançons un peu sur le niveau de ce que j'avais, les observations qui m'ont amené à entreprendre là, finalement ce travail un peu philosophique sur quelles ont été les causes qui peuvent amener un régime de gouvernement à ne pas remettre en question ses prémices fondamentales, à ne pas évoluer. So why, in the face of so much suffering and so much impact, what it could explain the absence of systemic learning. So let us, this is what the lac mégantic town looked like after the tragedy. You can see the foam that was used to contain the fire, and the cars that piled up, the DOT 111 that piled up in the city center as they derailed. So one thing that struck me was that the federal level agencies didn't perceive this as a sign of basically the self-regulation in place when it came to railroads. They blamed human error. Also, the fact that there were minority parliaments at the time and that the policy amendments that were going to be granted to railroad inspectors, granting them pecuniary sanction powers, so the powers to fine when regulatory violations were observed. These were postponed because of minority parliament. On dit, il était mort au feuilleton. On n'a pas pu mettre en œuvre les recommandations dans le fond, les amendements au niveau du régime réglementaire. Donc, on a blâmé un peu, bon, le régime politique, l'erreur humaine, hein, un nombre insuffisant de freins avait été appliqué. Et on m'a aussi expliqué qu'il y avait on ignorait le taux de compliance rate, comme on dit. Donc, on ne pouvait pas accéder, on ne pouvait pas savoir au niveau du gouvernement fédéral s'il y avait un problème sur le terrain parce qu'il y avait comme un manque d'informations, finalement. On a blâmé le manque d'informations, le manque Et puis aussi, bon, ben, les syndicats qui étaient plutôt rigides et qui ont fait en sorte que, bon, la réglementation a été changée au fil des ans pour permettre là, des opérations, par exemple, à une seule personne. Et puis, donc, c'était coûteux que d'avoir un syndicat fort. Et puis, la réglementation a fait en sorte qu'on a permis la fragmentation du réseau et l'arrivée de plus petits joueurs qui n'avaient pas les capacités d'autosurveillance des grandes compagnies ferroviaires. Les grandes compagnies ferroviaires ont de l'autosurveillance, ont du personnel de surveillance et peuvent mettre en œuvre leur propre système de surveillance, ce que les plus petits joueurs, dont la Montreal Made in Atlantic, ne pouvaient pas mettre en œuvre, ne pouvaient pas avoir. Donc, j'ai décidé d'utiliser l'atrophie de la vigilance. C'est une théorie proposée par William Frauenberg, et parce que ça nous donnait un cadre d'analyse. Et le cadre d'analyse est multiniveau, analyse les risques au niveau individuel, organisationnel et systémique. Et c'est une façon d'analyser et de rapporter l'information. So this was a theoretical framework I used in order to make sense of the events and also make sense of what happened after the event, what explained the lack of systemic learning. This is a systemic analysis of the crisis, how different factors weighed in and how there are also vicious circles in the sense that, for instance, self-regulations created contempt and distrust and minimal compliance. And then in turn, this also created a series of mishaps from the railroads and the political stakeholders with regards to what was actually happening on the field. And so this is just the list of let's say, the organizational deficits that I ran into, informational deficits, managerial deficits, and this was basically this is a depiction of the systemic complexity at play. Okay, just to tell you, and this was a build from an example from Mitrov and Srivastava in the analysis of the Bhopal crisis. So a similar systemic analysis has been applied here. Just to let you know how complex and interrelated all the factors of risks are. OK. Maintenant, analysons les facteurs individuels qui expliquent la tragédie ou qui expliquent la mise en place des zones de vulnérabilité. La complaisance est un premier facteur. Le fait qu'il y avait quelque chose qui s'appelle la routinized compliance, right? Minimal compliance, something that is ritualized, something that is basically, it's a paradox because the regulators will count on the railroaders to implement the safety operating procedures, but it was regularly ritualized in the sense that it was mainly symbolic. Yes, we are complying, but we're not necessarily actually committing to safety. So complacency played a role. There was a great underestimation of risks in the sense that we knew something was wrong. We knew that there were an increase of hazardous materials on Canadian railroads, but yet we didn't verify the information coming in from the industry. So for instance, it was wrongly labeled and the shipment was labeled category 3, which is a lot less volatile than what actually was being carried. And so this absence of counter verification created an underestimation of risks. And also mismanagement of policy reforms. There was a push towards audits, and instead of having hands-on inspections, the railroad inspectors became auditors, and this was a debacle. They felt powerless, and the industry perceived these policy reforms as actually a push towards self-regulation, which created a lot of tension on the field, the tension that was ignored by the higher-ups in the federal bureaucracies. And then when it comes to ignoring warning signs, and I think that when David touched upon the Texas blackouts, there were reports in Texas that recommended the implementation of several measures for preventing snowstorms from creating blackouts, and they were ignored. So a little bit in the same fashion, the environmental commissioner warned that safety plans were not in place and that the implementation of the regulation was known a lot of mishaps in terms of how enforcement was being carried out. So there's always a translation between a policy and its implementation and its concrete implementation. Well, there were warning signs about the lack of implementation or the unenforcement of regulations that came from another rail derailment in 1992 in Mont-Saint-Hilaire. So actually the derailment was a few years before that, but the regulation that changed in 1992 and the Transportation of Dangerous Goods Act, and it was not implemented or overseen, and these warning signs existed. There are several reports that were basically ignored. And the TSB also identified the safety management system, that regulation in place as a failure, but was basically a little bit out of the circuit. You know, it's a watchdog that could emit recommendations, but could not actually oversee the implementation of new policy or new regulations in place. Okay, so the individual level failures, this is just a little glimpse at it. There were more, and if you read my thesis, you'll in the chapter, you'll see that it's all of these factors kind of interplay together. The second level, if we rise up a degree of abstraction, we go to the organizational deficit. Une culture de blâme était présente à la fois au niveau des agences fédérales et au niveau des compagnies ferroviaires. Donc, les employés se sentent comme un peu en double bind. Je pourrais pas, si je prends une initiative, je retarde mon équipe, je retarde le plan et puis donc les règles étaient à la fois un peu contradictoires. Il y avait souvent des instants où est-ce que l'opérateur était présenté par un dilemme, et puis à cause de la culture de blâme de son organisation, n'a pas nécessairement communiqué ses sources de vulnérabilité au moment où elles avaient place. L'effet de fragmentation, le fait que la communication et la prise de décision soient faites en silo. Et les bureaucraties fonctionnent en silo. On le sait, c'est une des grandes caractéristiques de nos bureaucraties, c'est l'absence souvent de coordination interne et externe. On focus sur les lois qu'on a nous-mêmes à mettre en œuvre sans tenir compte, si on veut, de l'apport systémique, hein, des relations avec les autres organisations et les parties prenantes extérieures. Et donc, les bureaucraties étaient plutôt centrées sur leur propre mise en œuvre. On est une agence de réglementation et puis on ne sort pas de notre mandat, si on veut. La juridiction fédérale, on a, si on veut, un peu balayé la responsabilité de à qui revient la bonne marche du système au niveau général. Et puis, la diffraction des responsabilités, ce sont d'autres processus expliqués par William Cronenberg dans sa théorie de l'atrophie de la vigilance, comme les déficits de communication, les disjonctions organisationnelles, tous ces termes qui finalement expliquent là, les risques endogènes, okay, les risques que la bureaucratie crée par elle-même. L'autre niveau est le niveau de l'atrophie de la vigilance, donc au niveau vraiment systémique. Il y a une espèce de déplacement ici qui se produit. Les moyens deviennent les fins, les objectifs un peu laissent place aux moyens de mise en œuvre. Donc, je vous donne un exemple. Au lieu de se concentrer sur la sécurité publique, bon, ben, on va essayer de chercher des fonds pour continuer à financer nos programmes. Donc, il y a ici un détournement, si on veut, de l'attention vers les moyens. Ça fait partie, le déplacement des fins et des moyens fait partie, encore une fois, de l'atrophie de la vigilance. Et c'était aussi le cas pour plusieurs organisations que j'ai analysées là, au courant de ma thèse. il y avait beaucoup de pression pour la mesure de performance, l'absence, les réformes successives qui ont amené à déréglementer le réseau davantage et permettre la fragmentation du réseau. Donc, ça aussi, ça faisait partie si on veut, des pressions économiques, hein, des pressions pour le profit et ou la transposition des fins et des moyens au niveau des agences fédérales. On veut pas que les réglementations en place soient trop contraignantes parce qu'on veut soutenir l'essor économique du pays. Alors, au nom d'une politique de croissance économique, on va venir un peu mettre de côté les avertissements qui s'amènent. Alors voilà, au niveau des pressions économiques et politiques, il y avait un manque de compréhension des interventions fiscales gouvernementales. Les subventions aux compagnies pétrolières ont poussé les compagnies à réduire leur main-d'œuvre pour investir directement dans le rail, pour investir dans la réfection des rails. Et puis, c'est un peu ce pourquoi la Montreal Made in Atlantic était venue et a été fondée. C'est pour pouvoir revendre le rail à un prix supérieur. Et bien, les fonds publics canadiens ont été utilisés par cette compagnie pour augmenter son prix de revente, et ce, au détriment de la sécurité publique. Je vous explique. Pourquoi c'était fait au détriment de la sécurité publique? C'était parce qu'on a placé les membres du conseil d'administration de la Montreal Made in Atlantic en conflit d'intérêts. Ils étaient responsables de déterminer les seuils de sécurité et de faire de l'autosurveillance. Et en parallèle, on leur a proposé de l'argent pour investir directement dans le réseau. Ce qui a en fait, les conséquences des subventions via le Fonds d'investissement stratégique fédéral, ces conséquences ont été de placer cette compagnie devant un dilemme. Si j'investis directement dans le rail, la moitié de mes dépenses sont remboursées. Alors, je vais réduire ma main-d'œuvre, je vais réduire la surveillance et je vais investir directement dans le rail puisque ma valeur de revente va augmenter. Donc, on a vraiment, they really decided this trade-off. We're going to invest in the rail and we're going to receive federal subsidies because we're investing directly in the physical infrastructure at the expense of the human capacity, the envelope of protective mindfulness that high reliability organizations know how to manage and invest in. So therefore, after the crisis, we saw a lot of blame game, and basically the system was unchanged in the sense that the structure of self-regulation that was inherited from the decades of deregulation remained unchanged. And there, we added the number of rules in place where the rules in place were not implemented. So you see the paradox there. So lessons learned, top-down approaches, command and control mechanisms, they fail to promote safety in the sense that you can dig yourself further in that rationalizing process. And what I mean by rationalizing process is that denial of the systemic complexity at play and the denial of the fragmentation effect, and that the causes that were the main ones, so blaming technical error and adding a layer of regulatory enforcement mechanisms or a regulatory, not enforcement mechanism, but regulatory or just rules. Adding some rules will not change the fact that the existing rules are being poorly implemented and poorly overseen. So this is what I want to leave you on is the fact that, we must do better at understanding, risks and interactive complexity, and the safety thresholds cannot be determined by those who make the profit. If you are placed in a situation of conflict of interest, this is how catastrophes are nurtured by government, by placing those who determine the safety thresholds also in a position to determine how much profit they're going to make. And that's the whole situation where you make a trade-off between safety and profitability. I think that we need to really reframe this and be in a position to ask questions and establish the threshold, what this risk threshold in collaboration rather than in opacity. So thank you. And let us, if you have questions in the end, we can take your questions. Merci beaucoup.
Okay, thank you very much, Anaïs. We'll move right over to Lorraine. Maybe as you're setting up, I'll just make a general comment. One thing that disasters do is they involve the full spectrum from action at the level of the individual in the community, and that we could have a whole session just on that. And indeed, there's one chapter in particular in the book that looks at that, the fact that the front line is the community itself, but they also in many ways have the least resources. At the other end of the spectrum is the international environment. And again, we can safely say that really no disaster, at least in the terms that we've looked at it, does not have an international dimension. Even lac mégantic, but there are systemic issues relating to the international system, and that's what Lorraine will talk to us about. Thank you.
Thank you so much, David. Bonjour à tous. Good morning or good afternoon now. Comme vous l'avez vu au début, une dimension assez importante du livre se focalise vraiment sur la dimension internationale. Et pour démarrer cette partie, qui est la partie 2 du livre, je me suis particulièrement intéressée au nouveau cadre Sendai, mais aussi à l'évolution du cadre à partir de Yokohama en 1994 et au changement de cadre Sendai de 2015. L'un des éléments importants en réalité, c'est que les systèmes et la coopération internationale et régionale sont des éléments importants de toute crise et de toute gestion de désastres et de plus en plus de la réduction des risques. La communauté internationale a un grand intérêt et veut jouer un rôle de plus en plus prépondérant en fait dans tous les événements de réduction des risques, que ce soit aussi dans la réponse aux crises, aux urgences ainsi qu'aux désastres. Et ce, à toutes les étapes en fait du processus, incluant la prévention. The Sendai framework guides the development of national strategies. For instance, in Canada, we've noted that the Canadian government adopted the Sendai framework in 2015 and built on the non-binding international agreement to set new priorities, draft and publish in 2019 toward a resilient 2030, the new Canada's emergency strategy. En 2018, la province de la Colombie-Britannique avait dès lors aussi adopté le cadre Sendai pour aligner ses politiques et ses initiatives, ainsi que toutes les approches et toutes les phases de la gestion des urgences. Le Québec en avait fait de même en 2014 dans son plan d'action national 2014-2024, un instrument d'action publique qu'elle a vraiment ancré cette fois-ci dans le cadre Yogo. Cependant, à partir de 2019, la province du Québec a organisé un certain nombre de tables rondes et avec cette démarche collaborative et délibérative, est en train de mettre à jour ses politiques et son approche basée sur le cadre Sendai. So the Sendai framework was voted by the General Assembly in 2015 and sent for the first time a signal that the United Nations is integrating disaster risk reduction, sustainable development, and climate change. The addition of climate change and sustainable development was actually resulted from a feedback from a survey that was conducted by the European Forum on Disaster Risk Reduction Working Group, who actually advised the United Nations at the time to establish stronger linkages with the Sustainable Development Agenda and climate change framework at the local level via what they call the UNSDR Making Cities Resilient campaign. Donc, le changement a été soutenu par 3 accords internationaux ou 3 politiques internationales qui ont été adoptées la même année. Le cadre Sendai pour la réduction des risques qui débute en 2015 et se termine en 2030, qui a été adopté en mars 2015. les objectifs du développement durable qui ont été adoptés en septembre 2015 et qui sont considérés comme étant le suivi ou la prochaine génération en fait des objectifs du développement du millénium et les accords climatiques sous la convention en fait 21, les accords de Paris qui ont été signés en décembre 2015. So as part of the chapter, what I did is a review of the international regime governing disaster management. And what I've noticed is that it raises the same concerns and issues that governments, societies are facing at the national, regional, and local level. The key question of all these agreements is how do we move from a single hazard approach to a multi-hazard approach, and how climate change impacts disaster risk reduction. So from Yokohama in 1994 to Sendai, the international regime have evolved from a single hazard approach to a multi-hazard approach. And lately in 2015 does include a lot more climate and health into the mix. When it was actually adopted, the Sendai framework was presented as an agreement that really shifts the paradigm in disaster management. So I actually asked the question, is the Sendai Framework Agreement really shifting the paradigm in disaster management? Is it enough to add climate change and health to the mix and assume that we are really changing the way we approach disaster management? The Sendai Framework actually does shift the paradigm by providing a multidisciplinary, multi-sectoral, all-hazard, and a holistic approach with a focus actually not anymore so much on disaster management, on disaster risk reduction. So we're really at the early stages, at the prevention stages. The YOGO, oops, I have a bit of an issue. Here we are. The YOGO framework at the time was criticized for its lack of consideration for subnational actors. The Sendai framework assigns actually a greater importance to the society as a whole. Everyone in the society, from the neighborhood level to the state and the international level, have a role to play in disaster risk reduction. It calls also for the collaboration and the inclusion of marginalized and diverse individuals. So women, children, youth, elders, persons with disabilities, Indigenous people, everyone has been really listed. And the framework really talks about creating communities of practices and really relies on the idea of networks and community of practitioners to advance disaster risk reduction. There is also a movement towards the recognition of Indigenous traditional language and knowledge, not language, and the local knowledge as a supplement to scientific knowledge. Even though it is mentioned, the framework does not provide a smaller framework within which Indigenous traditional knowledge can be actually advanced. The other key element is the progress towards the converging health, climate change, and sustainable development within disaster risk reduction practices. But naming them, as I said, it's not enough. And what we've actually noticed is that it falls short regarding climate change and health, and particularly biohazards. Even though the framework does enable governments and international institutions to better embed climate change adaptation with disaster risk reduction, it does not really provide a sufficient framework to mix the two, really combine them, and look at policy instruments that can be implemented, developed, and implemented to consider climate change as a driver of disasters. The Sendai framework sent a signal, however, towards more policy coherence by linking together disaster risk reduction, sustainable development, and climate change. The Sendai framework pays closer attention to, as I said, the broader picture in which a convergence can happen. It does highlight that this is unavoidable. If we really want to achieve the sustainable goals, we're going to have to consider climate as a threat to development progress. So climate change is identified as a driver for disaster risk reduction. We know that climate change has an impact on hazards, and it also drives vulnerability by changing local environment conditions. So for instance, in Article 4 of the Sendai Framework, climate change is said to increase the vulnerability of communities faster in all countries. This is actually the first time that the framework is actually universal, underlying also the threats and the conditions in northern countries. The Sendai framework could have put actually a greater emphasis on how climate change can change and affect vulnerabilities of communities. Even though the Sendai framework actually considered multi-vulnerability with multi-hazard disasters, it does refer to multi-hazard. It does not refer to multi-vulnerability in this, and how multi-vulnerabilities can actually increase the density and the magnitudes of disasters. We note actually limits to the integration. In Article 15 of the Sendai framework, the framework differs climate change to the entity in charge, which is the United Nations Framework Convention on Climate Change. The language is soft and quite unclear. There is the use of words such as some disasters, some events. We're really, the international community is really using very broad terms and language. The Sendai Framework Agreement references climate change 13 times, but it does not provide any substantial strategies. It simply reiterates that climate is an underlying factor not to forget. On the health side, there is actually a much greater focus on health. And health, contrary to actually climate, has become an outcome after health actors participated in great numbers in the Sendai Framework policy process. So health is actually mentioned 76 times in the agreement, and there are 3 priorities that were set. The first one is the enhancement of the resilience of national health systems, the development of capacity of health workers, and the third part is being their training. And in the framework, actually, there is a mention, sorry, of disaster medicine. So contrary to climate change, the Sendai framework refers to the collaboration with the World Health Organization. It really focuses on the healthcare system and how we can really strengthen the response to health issues. And however, what it does not mention is actually biological hazards. Even though the framework refers to epidemics and pandemics twice in the agreement, pandemics and epidemics are actually not a central feature of the agreement. Biological hazards were actually discussed in the subsequent years, in 2016 in Bangkok, Thailand, and health was discussed in 2015 as part of the Global Platform for Disaster Risk Reduction in Cancun, Mexico. So on the health side, the Sendai framework requires the implementation of the regulations that are promoted by the World Health Organization. COVID-19 has actually revealed a lot of vulnerabilities in developing, but also in developed countries. On September 11th, 2020, the United Nations Assembly adopted a resolution on the comprehensive and coordinated response to the coronavirus pandemic. Governments called for a timely implementation of the Sendai framework and the Bangkok principles. They saw it as an opportunity to actually strengthen coordination to reduce the risk from biological hazards and foster systemic coordination and integration within health risk management. COVID-19 has also been seen as an opportunity to change the course and adopt a preventive approach to disaster management and risk-informed approach, putting an emphasis actually on learning and the sharing of information. So on my screen right now, you can actually read the 7 principles that have been adopted at the Bangkok conference. So in 2016, the International Conference on the Implementation of Health Aspects recommended 7 principles. We can call it standards and actually norms to be implemented in every single signatory country. Those Bangkok principles actually influence the choice of policy instruments, whether directly or indirectly, by setting the stage within which actually a policy decision and the choice of policy instruments can be done. What is interesting in the principle is actually principle 6. discussions actually have led to identifying the need to share information worldwide. And this is a step in a direction to what Louis Comfort, Elinor Ostrom called knowledge commons. So I will refer you to the chapter written by Louis Comfort in the book. She talks about the importance of knowledge and information, and she talks about and presents a bit more in greater details the knowledge commons. But what we're actually interested in seeing is a shared multidisciplinary open data platform where information can be gathered about past disasters, current risk, and this could potentially collectively inform action and decisions that can be done. The other elements that this emphasizes is that as we review the regime, there is a strong need to study policy instruments and disaster risk reduction. How do we manage crisis? Are we choosing the right instruments? And how the choice of instruments can actually lead to amplifying some disasters. And we've seen this in Africa, for instance, in Burundi. So in conclusion, the Sendai framework's new approach is historical, is a philosophical shift in disaster risk reduction. It does embrace a proactive disaster risk reduction approach. It represents a significant progress compared to Yokohama and Yogo in converging health, climate change, sustainable development with disaster risk reduction practices, but actually, is it enough? Even though we recognize the effort to integrate disaster, DDR, sustainable goals, and climate change, it falls short when it comes to climate change and health. Its non-binding nature raises questions as to its effectiveness and how the framework is actually going to lead to changes in countries. And we can actually raise this question in Canada because the strategy that was unveiled by the Canadian government in 2019 does not mention health at all. They have separated actually public safety from health. And we're now seeing the shortcomings of this approach by the federal government. Also, the federal government is really putting, even though it is emphasizing the idea of a whole society approach to disaster risk reduction, it is still focusing very greatly on single hazards. So there is a lot of work to be done by the Canadian government to move towards a multi-hazard, multi-vulnerability approach. By defining also climate change as a driver, the other issue is that the Sendai framework does not explore the idea that climate change could be considered a hazard, an emergency, a disaster, or a crisis. And at some point, we're going to have to define this because this could set the framework within which we're going to be able to develop and implement some of the policy instruments that will help us actually reduce and mitigate, adapt to climate change. Thank you.
Okay, thank you very much, Lorraine. There are many comments that could be offered, but I think we need to move along. So I'll invite Steve Troupin from the International Institute of Administrative Sciences to say a few words about these issues and the role of the IIAS in studying them from his perspective.
Thank you very much, David. I'm now going to set up my PowerPoint. Guess I should. Can you see my screen?
Yep.
Very good. So let me move forward. My name is Steve Troupin. Je m'appelle Steve Troupin. Je suis PhD en Public Administration et je suis secrétaire exécutif à l'Institut international des sciences administratives. So the IIAS is a learned society in public administration. Is one of the oldest, certainly established in 1930. We celebrated last year our 90th anniversary. It had been headquartered in Brussels since its inception. It has an international scope. It is a bilingual organization. The main working language is English, but originally it was a French speaking only institution. Something that is not so well known about us is that it's mainly a government sponsored organization. 40% of our revenues come indeed directly from subsidies by government all over the world. The IIAS is the owner of the International Review of Administrative Sciences, one of the oldest journals in public administration, ranked 90th in Journal of Citation Reports. It is also the mother institution of the European Group of Public Administration, or most prestigious entity. The IIAS has been working for quite some time now in what we could call the Politan Bouckaert tradition of comparative public administration, whereby national systems are analyzed in terms of their historical trajectory and also relative to their cultural aspects. How do we work? Generally, this is very schematically our workflow. Agenda setting occurs at the level of decision body. A number of themes of importance are identified in the scientific committees. Research groups are established, such as the project group that led to this book project and chaired by David Brown. These groups meet in the framework of the events we organize, events that target practitioners and scholars. Hopefully these meetings lead to publication, and that's the stage at which we are today. We aim to feed education program with our publication products, and last but not least, we also provide quality assurance services regarding education programs in public administration. As I told you, the IIAS is mainly financed by government. So today we have 30 member countries that you can see spread over the map. We are unfortunately underrepresented in North America, but still reasonably represented in Latin America, strongly in Europe and East Asia, and a little bit scattered over the African continent, providing us with a reasonable level of representativeness over linguistic groups and continents. One entity of IIAS is IIAS. IIAS is a federation of universities, and we have members in all these countries of the world, so it's a very inclusive academic society producing research through its working group, and IIAS should convene in Johannesburg in July for its annual conference. IIAS also has regional groups. So far we have 3 regional groups. We have European Group for Public Administration in orange. We have the Latin American Group for Public Administration in red, and we have the Asian Group for Public Administration. Each group has own research group producing research and convening in events. In terms of agenda for the future, the IIAS subscribes in general to the Sustainable Development Goals agenda, and this since the adoption of this framework. And more specifically, a number of key topics were identified for the next year. It's about aging or intergenerational solidarity, the management of inequalities, technologies, that will be the topic of the next conference in Johannesburg. Climate change was addressed last year in the 90th anniversary conference. Migration and population fluxes, and resilience, which is a general keyword for the theme we are dealing with today. Let me now go to this book. So this book fits into the IIAS Public Governance series. It's a natural venue for the publication of IIAS Research Group. IIAS self-published these books. It aims at a broad diffusion, and therefore we decided to distribute the ebook for free so that it can reach all our members in various regions of the world. And then there is a paperback version which is on sale for reasonable price on Amazon. Coming to the book, Dealing with Disaster, you see the QR code on the bottom right corner of the screen. By scanning this code, you should be able to download the book. Here is the cover. The cover represents the Great Wave of Kanagawa, a major artwork from a Japanese tradition that evokes the floods that threaten mankind, but also evokes the strong representation of Japanese authors and cases into this book. We were happy enough to collect a couple of endorsements, including one by Paul Joyce, the incumbent director of publication of the International Institute of Administrative Sciences. Our program for 2021 will consist in two main events. So as I mentioned, the first one is the IIAS 2021 Conference on Public Administration and Industry 4.0. The call for paper has just been upgraded, notably with an addition co-signed by Anaïs with Owen Podger from the University of Canberra. We are very happy with this collaboration. And on September 7 to 10, the ECPA 2021 conference will take place in Brussels, hopefully. But in any case, we will go forward with our events on a hybrid way. We are also going to focus on our efforts on the restart of the International Commission on Accreditation of Public Administration, Education and Training, not teaching. It's our quality assurance body. It was established almost 10 years ago now, and its governance was upgraded and new people were appointed in key positions. We will also focus on the further development of our publication series, the IIAS Public Governance series, and also our new e-journal developments in administration, which specifically aims at achieving a greater connection with the conference paper we collect. I kindly invite to follow us. I would like to insist out of these nice social networks on two elements. The first is our YouTube channel. We have a nice channel there. We uploaded most sessions of our last virtual conference, including sessions on disaster management where the book was already presented, including a session on COVID-19 in California that we could organize with Anaïs, and also our MailChimp for newsletter. You can also scan this code to stay up to date with our latest developments. I think I'm going to stop here and give the floor back to David, that I would like to thank very much on behalf of IIAS for this milestone publication that is perfectly relevant in the current context and that helps us to position this new series in the landscape. Thank you very much also for the University of Ottawa for the invitation, and see you hopefully next time.
Thank you very much, Steve. We have a few minutes left, and I think I'll probably do most of the talking, but if we have any time, I'll invite the three panelists to see if they have a sort of 20-second last word before Chris Cooper closes or wraps us up. I guess there's three things I'd like to say, which along the way will allow me to comment on a question that was raised through the Q&A box. The first is that I'll go back to a marker I put down at the very beginning, and it's I think was highlighted by the maps that Steve had of the participation in the IIAS. You'll notice Canada's total absence from all three categories: member state, corporate membership, or regional membership. I think it's shameful. It's a lack in public policy. It's insularity on the part of the Canadian academic community. I'm making myself very, very plain here. We have had some discussion with IPAC and with CAPA to encourage them to at least look at corporate membership, which is available for a very limited amount of money. It's more a question of interest and attention. So I'm saying all of this rather bluntly and forcefully in the hope that we might be able to ignite some interest and help to open up the thinking and perspectives of Canadian public administration, because we need it. Now, second point, one of the, going back to my earlier slides and my comments, when you're looking at these issues through a public administration frame, one of the basic issues that all administrations face, and I think you can find this threaded through the COVID-19 experience as well, is when do you use the existing institutions and processes of governance and of public administration to respond to disaster situations? And when do you create specialized or accelerated capacity? And there's no question that if you can design, if you can anticipate what might happen and design your institutions and processes around that, that, you know, it's easier to then bring it into action and focus on whatever the situation is. The problem is that in the meantime, your fire engine is sitting in the fire station unused, and it becomes a little bit easier to let that capacity go. In Canada, we have the example of having a world standard epidemic monitoring system established in Health Canada that was closed down 2 years ago or 3 years ago, I guess now, presumably because it was too expensive and it was an easy cost-cutting measure. Not trying to be critical here, but it illustrates the dilemma. When do you make it part of, how far can you go in building on traditional public administration perspectives? How much, at what point do you need to reframe traditional public administration? Okay, the other comment very briefly is the emphasis on the individual and on the community as the ultimate most decisive aspect of disaster management. And that's really the essence of the question that's being asked. Public opinion, Canadians are conservative. They don't want to be asked new things or to do things that they aren't used to. I'll just share with you the approach that the Japanese take, which is, I think, easily the world standard. Their official government policy is based on what's called self-help, co-help, and community help. And basically, when a disaster like a tsunami occurs, the expectation is that people will first look after themselves. They will then look after their neighbors and ultimately their community. And they should not, as a matter of policy, expect the state to intervene before 72 hours after the event has occurred. What they have then done is not only state that, but then create an environment, a learning environment within society, helping people to equip themselves to face these situations, help businesses, help municipal governments. So that's the foundation around which everything else, all these other questions get built. Okay, I'll stop there. I promised Chris Cooper I'd leave him at least 30 seconds before we turn into pumpkins, so this is the moment.
Great, thank you. David, Loren, and Anaïs, thank you so much for being here today and sharing your work. Disasters, listening to this, you could study the field of public administration from disasters, blame, blade avoidance, learning, organization theories, power. Everyone is intrigued by this. They bring their own interest to this, because I think disasters touch upon so much of public administration. So I think I think we all look forward to seeing this research and to opening our eyes to disasters and looking at public administration in a new way, something very familiar for us, maybe power or blame, now through disasters. So thank you to that. Steve, thank you very much for being here as well. And I would just like to say the International Review of Administrative Science is an absolute fantastic journal, which we all go to time and time again. And increasingly so, it's great work. So thank you to everyone being here, a part of our PAP seminar. Le prochain séminaire sera le 18 mars avec notre doctorant Jackson Reggie. Donc, vous êtes tous bienvenus, bien sûr, pour ça aussi. Mais c'est tout. Je suis une Citroën. Merci. Bonne journée.
Bonne journée.
Merci.
Thank you.
Merci, bonne journée.
Plaisir.